Good afternoon, folks. This afternoon's topic C discusses the widowed effect. This topic is how losing a spouse can affect your health. So we're going to go through that today, and it falls under end of life care for aftercare for people. So I'm going to do a show on how this affects your health after somebody passes. For those of you who have lost people, this may help you. Okay, so here we go with today's presentation. Please join me in today's presentation. See, the widowed effect. How losing a spouse can affect your health. The widow effect refers to the increased risks of increased risk of death that a surviving spouse faces after the loss of their partner. This phenomenon is particularly observed among older adults and is most pronounced within the first 3 months of grieving. The chronic stress from grief can impact the body in several ways, okay, including poor sleep, weight loss, decreased immunity, and even increased risk of heart disease and stroke. Okay, here you go. Experts suggest that physical and emotional tolls of being a caregiver, the physical impact of grief contributing to the widowed effect. It's important for surviving spouses to seek social support and practice self-care, help manage their grief and find healing. If you or someone you know is going through this difficult time, reaching out to friends and family or support groups can make a significant difference. Second page. Taking care of one's health and well-being is crucial during such a challenging period. Okay, so here I'm going to give you some resources now. National Council on Aging, Bright Star Care. Okay. If you have any more questions or need further information, feel free to ask. Okay, me as an end of life specialist, I'm certified in end of life to help the families after someone passes, or I'm certified to sit there with the client as they come to grips with their diagnosis or end of life predicaments. My job as an end of life person is to make it as comfortable as possible and as easy as possible for someone. So, I can do I can sit with a person. I can help them go through the process of that, or if I have time, because some people have 6 months, some people have a year, some people have like 2 weeks, some people have less. But what you do as a end of life specialist is you sit with them and you let them express their feelings about the if they have a terminal illness. You let them get things out, and you show them how to you show them tools to help them cope with it. It's not an easy profession to be in, but I like being certified in end of life. I like helping people um, with that aspect of their journeys. It's very eye opening because you see somebody that's passing, and you see somebody who is maybe a family member who maybe they've had some issues with this person. That's the time that people fix issues, is at the end of their life, when they're sitting on their bed, um before they pass, and they ask to see somebody. Your job as an end of life specialist is to try and find that person for them, so they can sit down with the person and maybe say sorry, or maybe explain things before they pass. Or if it's a loved one that you're sitting with, that you're helping, like I've done in the past, um, you have to separate that from the moment. You have to separate that from end of life care. The fact that they're your family member, it makes it easier for you to help them go. If you tell them it's okay to go, and that you are there to help them with that process, it makes it easier for them to accept. Because some people have a hard time accepting the fact that they have a terminal illness, and the fact that they're not going to be around to see a certain event or a certain time in their life that they're used to seeing. So it makes a difference to be an end of life specialist. And um, I chose this subject for C because when I talk to somebody about grief, I give them I give them some examples on ways that they can remember their loved one, so they could ease their mind about them being gone. Like, for example, if you have a picture of the person that passed, that is a good picture that you can put on a blanket. Then you can do what we call in end of life care blanket therapy, where if you're having a bad day, you can take the blanket you've made and wrap up in it, and remember that person that way. Or if you yourself are having a bad day, and you know what cologne the person wore or perfume the person wore, spray your pillow with it. It works. I've seen where people um, take and put shirts on that the loved one had, or a piece of their clothing. That helps them deal with the fact that they're gone. Me personally, I've had family members pass. I've dealt with it differently for each one, but I've always dealt with it differently. Like for one, I made blankets for blanket therapy and sent them out to people. For two, I've used a certain perfume to help me go through that process also. Like I said, it's not an easy process, but it's a nice profession to be in, so I could understand. Now, if I wasn't certified in end of life, I wouldn't understand how the process is supposed to go. I'd be scared if it wasn't one of my family members. Like I said, I've had family members pass. I've been I if I didn't know it was gonna go on, I'd be scared. But because I know how it goes, it makes it easier for me to deal with. So that's why, one of my certifications is end of life care. Hope this information helps somebody that's going through this. Losing a spouse is not easy. And those of you who have dealt with it before, it just gets easier to deal with. It never goes away. The saying is that when your loved one passes, they're still with you, but they walk beside you. But you can't see them, but they are. So, with that being said, I thought I'd do that show for you all for C. So, for now, Gator Wellness, take care, folks. As I'll do D if I get back on. I'll let you guys know if I do D. For now, Gator Wellness, take care, folks.